Welcome back. We are jumping straight in today for a deep dive on a really important blood test, the full blood count. You'll often see it called the FBC.
Yep.
Our mission here is to sort of demystify it for you, to tune those numbers into something you can actually understand, especially if you're navigating the NHS.
Absolutely. And just so you know, all our insights for this are coming from the excellent comprehensive guide on the Blood Test UK website. It's a fantastic resource.
Okay, let's unpack this then.
Yeah.
When they take that little vial of blood, what are they actually looking for? What is the FBC count?
Well, it really boils down to three main types of cells.
Right.
First, you have your red blood cells. We all know they carry oxygen,
Yep,
right?
that's the basics.
But the key thing inside them is a protein called hemoglobin, and that's what doctors are really looking at. It measures your blood's capacity to carry oxygen.
So it's not just the number of cells.
Not at all. It's the quality. For example, they look at something called mean corpuscular volume, or MCV.
And what's that?
It tells us the average size of your red blood cells. And if they're too small, it often points directly to iron deficiency anemia, which is a really common issue here in the UK.
Okay, so that's component one. What's the second?
The second is your white blood cells. These are your immune system's front line, your little defenders.
The germ fighters.
Exactly. And what's really fascinating is that the test breaks down the different types of white cells. A high count usually means you're fighting an infection, but knowing if it's your neutrophils or your lymphocytes that are elevated helps doctors figure out if it's, say, bacterial or viral.
I see. And the third component?
Platelets. They're tiny, but they're absolutely crucial. They're the ones that rush in to help your blood clot when you get a cut.
So if that number is off?
Well, a low platelet count could mean you're at risk of bleeding, or it might signal some other underlying issues. So those three components give a surprisingly detailed picture.
Let's talk about the procedure itself. Here in the UK, how does it work?
It's very simple.
It usually starts with your GP.
Yeah.
They request the test, and then a trained professional, a phlebotomist, will perform what's called a venipuncture.
Which is just the clinical term for taking blood from a vein. It's quick and very, very safe.
And what about preparation? Do you need to fast?
Generally, no.
Yeah.
Not for an FDC on its own. However, the expert guidance from Blood Test UK does say it's a good idea to maybe skip a big, heavy meal beforehand if you're having other tests at the same time.
To keep other results accurate.
Exactly. Things like glucose or fats in your blood, it just keeps everything reliable.
And when the results come back from the lab, they give you reference ranges.
Yes, and this is so important. Those ranges are not one size fits all. They change based on your age, your gender. For instance, a healthy hemoglobin level for a man is different from that for a woman.
So it's tailored to you.
Completely. It allows for a much more personalized assessment of your health.
Okay, this is where it gets really interesting for me. The benefits. Why is this test so powerful?
I think the biggest thing is early detection. Research from UK health institutions really backs this up. The FBC is amazing for preventative care.
How so?
It can spot things like nutritional deficiencies or other risks long before you'd ever feel any symptoms. It's especially useful for, say, older people, helping support long-term health.
And what about for people already managing a health condition?
Oh, it's vital. For chronic conditions like diabetes or rheumatoid arthritis or kidney disease, doctors use the FBC to track how things are going.
So they can see if a treatment is working.
Precisely. They can monitor progress and adjust medication based on what the blood is telling them. It's a proactive approach that genuinely improves quality of life.
So to wrap up, the FBC is a powerful early warning system.
That's the perfect way to put it. It helps detect infections, anemia, even more complex blood disorders, giving you a chance to manage them better and sooner.
So the final takeaway for you listening is that these numbers aren't set in stone. Your lifestyle choices can actually have a big impact.
A huge impact. Your diet, how much water you drink, stress, smoking. All of these can influence your FBC markers, even if just temporarily. High stress, for example, can sometimes cause a brief spike in your white blood cell count.
Wow.
Which leads to a really interesting final thought, doesn't it? If a test this simple can be affected by everything from the iron in your diet to how much sleep you got, what other surprising insights about your daily life are hidden away in just one small sample of blood?
A great question to end on. We'd really encourage you to explore the resources over on the Blood Test UK website to learn more.